Hi guys, I'm Dr. Hilbert. I'm your friendly concierge medicine physician here in San Antonio. I'm here with Chastity Morales, part of a recurring series. She's a strength coach here in San Antonio that really helps work with me in a collaborative fashion to bring health to San Antonio. So one of the things I guess to kind of lead into it is like we have to have tools and information. One of the things I have available in my office is called DEXA scan, and we have additional software on the DEXA scan that does body composition analysis. And a lot of people, like we have the traditional BMI, which is just a measure of your height and weight in proportion, and it gives an estimate of what your body fat is. And most people feel that it overcalls their body fat. The reality is when I do the body composition analysis, it could be pretty shocking to them. So I prepare my patients. I go, listen, it's not going to show you what you're going to think it is. The vast majority of people is going to have a much higher total body fat than what their BMI predicts. And then for me as a physician, things that I look at when I'm counseling them is I look at, one, what is your percent total body fat? You know, how much pounds of lean muscle mass do they have? Because then you can calculate how much protein that they need per pound of actual lean body mass, and not necessarily what their total body weight is, which is a really helpful tool is the resting metabolic rate. Every kind of say, well, I should eat 2,000 calories, kind of just, if you're a man, 1,800 for a woman. I have a lot of folks that are 1,100 calories, the resting metabolic rate, right? And that's, 2 meals can blow that.
Right.
And if they're not doing anything,
Right.
you're not getting anywhere. And I give an example. I have a patient, he's 269 pounds, 6'2", pretty meaty looking guy. His resting metabolic rate is 1,900 calories.
Mm-hmm.
He doesn't have to eat that much to maintain a body weight, which is very unhealthy for him, 269 pounds. That is the challenge. And so with those tools, we have someone like you who can really it really helps me out a lot. So I've been talking here.
No, you're good.
Go ahead
and I think it's important to have this type of information, especially when it comes down to the training aspect. And I know you and I have been working together, which has been great. I've typically had most of my clients do the basic in-body, right? I look at things like the skeletal muscle mass, I look at the body fat percentage, and then I also look at the basal metabolic rate, their resting metabolic rate, right? And these things kind of help me indicate how this person needs to train. So if someone's coming in with the higher metabolic rate, then we look at it like, okay, we obviously see we have some wiggle room, but we also see that your skeletal muscle mass is significantly low. You know what I mean? It's in that declining effect. So what I can essentially do is put somebody in a base of nutrition that puts them in a calorie deficit, right? Essentially eating less calories than they're burning throughout the day to help them really lose that weight. But what I love about what your body scan pretty much provides is, like you said, the visceral fat side of it, like giving people a lot more information about themselves outside of just the 3 metrics that I kind of more so look at. So it puts it in more of a perspective of them of, hey, yes, your skeletal muscle mass is here, body fat percentage is here, here's your basal metabolic rate. Awesome. Well, look at your level of visceral fat. This is, like you said, this is what's going to cause the diabetes. This is what's going to cause extended, forms of cancer. That's what I like about it, because then it puts a lot of urgency on them making these essential changes to getting yourself on a proper routine, putting yourself on a good diet, and finding the help and resources that you essentially need to be able to deplete a lot of those deficiencies. And when it comes, even with somebody who is maybe has a higher metabolic rate or may burn a little bit more calories throughout the day, we also look at it as a surplus. Somebody who needs to build a little bit more muscle because their skeletal muscle mass, again, is depleted. We know that skeletal muscle mass is going to help somebody when it comes down to the form of aging, living comfortably, being able to keep that high metabolism, just overall being healthy. So we are able to identify that with these tools, and for a trainer such as myself, it allows me to understand how that person's body works more internally, and then how I can do the approach to their training, to their nutrition, and things of that sort. So all of these bases of information help me indicate how I can specify a certain program for someone, as well as a specific nutrition plan to get them to where they need to be.
Yeah, with good information you can make good decisions. So I just find it to be very useful and eye-opening. Because someone, have somebody who has, I think, 96 pounds of muscle and 180 pounds of fat, or something like that. It's just, and they wonder why their knees hurt, their back hurts. It's because you don't have a lot of muscle and you're trying to carry all this other tissue that's not really helping. And one of the best predictors of mortality now is strength. It's VO2 max. And so So fitness, our body's meant to move more. There's more neural connections and advanced evolution in our brain is more for movement than anything else. And so we need to be moving as we get older. Never stop, keep doing stuff, getting strong. And and I can't be in the gym with folks, and I can't design every part of their program. And so I just noticed a part of my practice just to help my patients is to reach out to the community. Like, where do we have these little classes? We have people here in San Antonio that can help folks, be strong, be fit, really at any age. And so
it's providing that help and those resources, and going to a professional that's going to help you get there and help you with the steps and help you follow your process, right? And another thing that I love about this is that it tracks for you. So you actually get to see these progressions, and even for someone like yourself, and even like with what I do in the training side of things, we need to make sure that we're actually progressing this individual, not necessarily, and this being able to have that collected data throughout their process shows, is what we're doing essential for you, or do we need to make some additional changes? Because everyone's different, everyone's going to take diet different, everybody's going to take exercise different depending on what they got going on. And then another thing that I always tell like my clients and even the clients that we work with is, yes, weight is an important thing. It's not the most important number on this sheet.
Absolutely.
It's going to be so many different data points that you have to look at, because weight's going to fluctuate depending on your muscle to fat ratio, right? So I think when it comes down to those factors and telling them that, hey, most people will jump on a scale and be like, oh my gosh, I'm 150 pounds, what's wrong with me? But then they do their scans and they realize that, well, actually your body's made primarily of muscle. You're going to be a bit more dense than the average individual, if anything. But giving them these proper indicators and for them to understand what they have going on based on the metrics of what the scan is able to provide them with is crucial for someone to understand, especially as we get older,
People do get fixated on a particular number of weight they want to be at, and so I have a lot of people, usually women that say, hey, I want to be 120 pounds, just for the sake of being 120 pounds. And I'm like, well, then I get nervous. I'm like, well, I don't know if I want you to lose weight, because as you get older, a little bit of weight, provides reserves for illness. So if you get sick, you get pneumonia, you get in the hospital, if you don't have some fat to burn, what are you losing? You're losing muscle. And you lose actually heart muscle when you're laid up in bed. And so that's very negative. So I like to get a look at that and not say, hey, we're losing weight, but are we losing muscle? Are we losing bone density? And so this helps track that. And so we can't, we really could provide them a safe avenue to be tracking those other metrics to say, hey, I don't care if we're losing weight, if we're not losing muscle or bone, you have to have a certain amount of fat to be healthy. And that's important too. And so, but that's a very nuanced, detailed approach that without having that information, you really don't have a way to glean that insight, because you don't have it, And so otherwise we're just looking at the BMI number and go, well, I don't know, lose 10 pounds, or don't, because I don't think you should, because you're 65. And I think, and statistically, women, when they get a little bit older, being a little bit overweight is better than being necessarily in the normal weight range, because of hip fracture risk and falls and injury, and then just if you get sick, just going into those reserves. So
I think this information is important, and just speaking from my side of things in my industry, the more information the better for the about the individual, right? It gives me a better opportunity to understand what we need to target, what we need to work on, where the areas of improvement can be, where they are improving, where they aren't improving. And again, I've used the 360 InBody scan, and it gives me the basic information that I need just to show the person's progression points. But what I love about what your scan provides is every fine detail down to, like you said, even the visceral fat.
Yeah, I had someone recently come in who had, I think it was a biometric impedance device, and it predicted that their body fat was 30%. I put it on my machine, it was like 39%. And it was a higher end place, and they're going to a specialty weight loss kind of clinic. And information just wasn't very accurate.
I think I did it myself too, and I was like, wait a minute. It's kind of humbled me a little bit, because even though I exercise on a daily basis, and I have my points where I'll fall off, and I'll be human every once in a while. Just for me, it was more like, let me understand where I'm at, and it took some time to really measure everything from the bottom of my feet all the way to the top of my head, which I love, because it took the time to really identify where everything was, and where I currently was, just even for someone who does this as a profession.
Right.
You know what I mean? And just being able to understand those things about myself. Now I'm like, okay, now I see maybe I do need to eat a little more protein throughout the day. Maybe you know I'm not as my bone density or my muscle density isn't as sufficient as I thought it was. Those types of things. And for me, especially in my field, that I like the opportunity for areas of improvement. Even though this is something that I added to my lifestyle, it's always good to know where you're currently at and how you can essentially get better. So I think that's really important when it provides that type of information.
It's been a huge help to my practice, and I love to have this tool. You know, so like I tell my patients a lot. You know, good information to like my labs, other modalities is like, say, like having satellites reconnaissance for like if we're going to war. You know, we want information before you just leap into battle, right? You want to know everything, and this really helps provide in a very clear, objective way with no emotions attached to it. These are numbers, there's data, and we have the skills and knowledge to interpret that and then make a plan that's based off of that to really help bring good health and vitality, you know, back to people.
So with your practice, is this something that you require each one of your patients?
I don't require it. It is generally an additional fee. I do have people that lost a lot of weight, and then when I get down to the number, kind of like I alluded to, then I'm like, listen, if we're going to go further with this, I need to make sure we're not losing muscle and bone, because you know then I think it'll be unhealthy. You know, and so that's when I really will require it. You know, that's the kind of only scenario that's required. But I have a lot of, not the majority of my patients, but a good number of them that do it, and it's been very helpful to me, and they've been happy with it. And it's generally, I don't offer it to some people that think that because with anything that can hurt, like psychologically, if not really ready for the information, you know, you have to give them education and kind of tell them what it is, the context, because you don't want to come out dejected. And it's rough information. Like for me, even getting in the machine, like I had to psych myself up. I took a couple of months to get in there because I wanted to make sure that my number was good.
I mean, it's humbling.
Came out okay, guys. Not amazing, but pretty good.
Yeah, it's humbling. I mean, even for people like you and myself, like we practice this. We try to practice what we preach, and even then, when you think you're at your most healthiest, you're like I said, areas of improvement. But I like the fact that we've been able to create some type of partnership, and a lot of the people that I've been working with that are coming from your office, and even like vice versa with clients I'm going to be sending your way, I feel like this is when it comes down to this essential collaboration, this is a lot of key information and the best way for you and I to communicate, right? So if there's something going on, you can tell me that. And I love that you've been giving me, like whenever you send me a client, you give me all like the more basic information, but I always ask you, like, do they have an in-body scan? Just so that way I can kind of know a little bit more about the individual. Because again,
you sent someone back to me and say, hey, I need this information, and they signed up for it, because it's just such a valuable tool. You know, I mean, it's, you know, we spend a lot of money on things that don't provide a lot of value or information, and for us, I mean, this is a very affordable, it's cheaper than going rate, because it's really kind of discounted to my patients in practice. So it's good.
And it provides the information that they need to get better. It helps the process.
I agree. All right, guys, well, that's about all we can do, I think, on body composition analysis. But thanks for joining us. If you have any questions, concerns, or just leave a comment, it's Chastity Morales. Get strong, call her. Get healthy, call me. All right, guys.